In March 2020, MedGlobal conducted the first of these medical brigades in Cúcuta. Despite numerous challenges, including reduced number of volunteers due to international travel restrictions and rapidly changing infection control protocols, MedGlobal was still able to provide the essential care and services to residents of Talento. MedGlobal's week-long medical brigade marked the first time that medical care was brought to the residents of Talento.
We are in the midst of the El Talento Medical Brigade organized by MedGlobal. During this week, we've been delivering medical attention to the population of El Talento, and as you can see, each doctor space has a doctor accompanied by a translator, and there each patient starts telling their symptoms and affections while they receive proper medical attention. All of this has become possible thanks to the MedGlobal organization, the religious leaders of the Centro Cristiano El Talento, and the community leaders, whom, together with their communities, have joined forces to carry out this brigade.
My name is Jan Klein. I am from Shelburne, Vermont, in the U.S. I so far have been in Cox's Bazar in Bangladesh with Rohingya. I had the extraordinary opportunity last summer of going to Gaza, and now here I am in Cúcuta, and I greatly respect the leadership skills and the willingness to roll up sleeves and work in sometimes uncomfortable conditions, sometimes among people that are very, very different, and sometimes work among people who have a whole host of problems. And leadership sets the pace, and they set the tone, and they give us all great energy to do the very, very best we can. You know, you never know what you're going to experience in terms of patient needs until you get to a place. And we thought here we would be in rural Colombia on the Venezuelan border, and many people would be sick. What we have found is that many people are really healthy. Not many kids are sick. We gave out very little cough medicine to children, very little acetaminophen, very little antibiotics. Yes, there is some nutrition, some malnutrition, and yes, there are some needs with some everyday things that all of our children get, coughs, colds, stuffed up ears, if you will. And people were very grateful. They were very pleased with the care they got. They greeted us with smiles as large as our smiles, which is very fulfilling. It means that we have been able to connect despite language, despite other parts of our lives that are very different, and to follow in MedGlobal's mission of reducing healthcare disparities around the world.
Hi, my name is Argenis Mena. I'm CEO for Dr. Luke Foundation. And so actually what motivated me and my wife to actually come to this region for humanitarian assistance is the fact that this has become the main entry doors for the exodus, the largest exodus or diaspora in the whole Latin America. But as a physician, I didn't want to be part of that statistic of medical doctors who actually leave the country. Instead, we moved here to the border so we can still work and support them in as much as we can with all the Venezuelans who cross every day, as well as actually coming back into Venezuela, mainly the border, so that we can assist in the many areas like we do for like probably about 8,000 children every year. The assistance here, besides water, the needs it's based on education and health assistance. And so this is why we link together with Pastor John, so we can move together in order to bring aid to this community. As health, it's a very important issue here. Actually, there's nothing here for people when they get sick.
My name is Rachel. I'm from Florida in the United States, and my husband and I, along with our 3-year-old, have been here in Colombia working with MedGlobal for about 2 months now. I have really appreciated how welcoming all of the staff and volunteers have been to our family, and especially since we have a little girl, it's been wonderful to have that kind of support. My husband is one of the doctors working in the clinic, and I was really hoping for some opportunities myself, and the people here at MedGlobal have been wonderful to help me to plug in. I also have a background in global health, and they've allowed me to help out with the brigade here in El Talento. I've been getting to do some public health education with people who are in the waiting area at each of the 3 sites. I've been teaching them about hand washing and preventing mosquito bites and some basic things that are major problems here in the community to prevent the transmission of infectious disease.
This time has been such a blessing for hundreds of people who needed it. Just from an allergic to major sicknesses, you know. And so it has been a great and amazing project. Thanks to those who actually have given and believed into this project. We are grateful to you. Even you might not see the many patients, but they have been touched by the generosity. Thank you very much.
It's been a really great experience. I've appreciated the opportunity to be here.
You know, I've been in Gaza. The people were very grateful, but they didn't connect with us. There's a male-female thing in the Middle East and even so, even the women didn't really connect. They would smile at me, but from a distance. In Bangladesh, they would connect, but they were still traumatized that it wasn't a genuine connection. Here, whatever the trauma was, they've been able to move beyond it to a certain extent and genuinely connect and interact and listen. For example, when I would show a mom or a dad how to drop the medication to give a child a dropper of medication, I would show them and then put the medicine back in the bottle and say, here, you show me that you can do it, and have them give it to the child. So I didn't need to take over that process of being the only person to work with the patient, work with a child, a baby. The parents were very willing and eager to step in and have that experience and take the lead in caring for their family. And I really appreciated that. So many times in Bangladesh, families weren't able to do that for one another. And that tells me a lot about the strength of the community. The faith of the community, I realize, is very, very strong, and I respect how important that is in the cohesion of this community. I am really looking forward to coming back to Cúcuta quite seriously. I really have enjoyed it here.
Preparing for COVID-19 was certainly one of the greatest challenges throughout the brigade. It required ongoing coordination with the Ministry of Health, ensuring access to personal protective equipment for medical volunteers, and working closely with community leaders to make sure that we were able to enforce distance between patients and provide community education. We're fortunate that we're able to continue to provide medical care throughout this pandemic. Our clinic in the Comuneros neighborhood remains open during the national quarantine for general medical consultations and prenatal care, including lab services and medication. We have implemented multiple safety protocols to reduce the risk of infection. At this time, MedGlobal continues its work throughout the world, meeting the healthcare needs of migrants, refugees, and underserved populations.
This is the beginning of efforts that we hope to continue at least 3 times per year in conjunction with the Cruz Roja Colombia. Please go to our website, take a look at the Colombia project, see how you can help. Any help would be well appreciated. We're going to update our social media all this week, so please come back, follow up, see how this project is moving along, and any help you can give us will be well appreciated. Thank you so much.